In first news conference as HHS Secretary, Kennedy says autism is an epidemic in the U.S. Advocates for people with autism have criticized this position as harmful and misleading. Existing research has explained autism as a multifactorial condition that is influenced heavily by genetics. Experts have largely attributed the steady rise in autism prevalence to better understanding of and screening for the condition, including a U.S. Centers for Disease Control and Prevention report this week that indicated a rising rate of autism along with increased access to identification among previously underserved groups. But Kennedy amped up his message on Wednesday, saying that people who accept this explanation are epidemic deniers who are playing into an industry canard. One of the things that I think that we need to move away from today is this ideology that the autism prevalence increases, the relentless increases, are simply artifact of better diagnoses, better recognition, or changing diagnostic criteria, he said. He also called for real-time data on autism prevalence, likening autism to a measles epidemic. We don't wait 2 years to react to a measles epidemic or any kind of infectious disease. We shouldn't have to do that for diabetes or autism, he said. Dr. Walter Zahorny, an associate professor at the Rutgers New Jersey Medical School and a co-author of the new CDC report, joined Kennedy at Wednesday's news conference and echoed his claim that the rise in autism prevalence is an urgent public health crisis that could not solely be attributed to better awareness. I would urge everyone to consider the likelihood that autism, whether we call it an epidemic, a tsunami, or a surge of autism, is a real thing that we don't understand, and it must be triggered or caused by environmental or risk factors, he said. We need to address this question seriously because, in my opinion, for the last 20 years, we've collected data but not made real progress in understanding what causes autism or how to effectively prevent it or treat it effectively. Kennedy said that autism research will fall under the new Administration for Healthy America in a new chronic disease division. He said that he plans to announce a series of new studies to identify precisely what the environmental toxins are that are causing it within a few weeks. The cause of autism isn't fully understood, but research has indicated that genetics may play a significant role. But Kennedy said that this line of study is a dead end, instead pointing to factors including mold, pesticides, medicines, and ultrasounds. Genes do not cause epidemics. It can provide a vulnerability. You need an environmental toxin, Kennedy said. On Tuesday, the CDC published new data showing that autism rates increased among children in the U.S. About 1 in every 31 children was diagnosed with autism by age 8 in 2022, up from 1 in 36 in 2020. Improvements in early identification of autism have been apparent, the authors of the CDC report wrote, and differences in the prevalence of children identified with autism spectrum disorder across communities might be due to differences in availability of services for early detection and evaluation and diagnostic practices. The new study is based on surveillance data from 16 areas that participate in the CDC's Autism and Developmental Disabilities Monitoring Network. The data is not